Hello my students, I would like to demonstrate in this video the third clinical step of complete denture construction, which is commonly known as centric visit. How many relations must be registered in this visit? Orientation relation, vertical relation, and horizontal relation. The sequence of these relations is very important. Orientation relation or orientation of occlusal plane. What are the occlusal plane? Is defined as the average plane established by the incisal and occlusal surfaces of the teeth. The orientation of occlusal plane is the relationship of the maxilla to the base of the skull. Determination of occlusal plane. 3 points should be determined at least to determine any plane. So, what are these 3 points for recording the occlusal plane that should be determined? These 3 points are showing 1 to 2 mm of occlusal limb below the border of the resting upper lip at the midline, as shown in the figure. Anteriorly, occlusal rim should be parallel to the interpupillary line, as shown in the figure. Posteriorly, occlusal rim should be parallel to the allatragus line or Camper's line, as shown in the figure. After correction of the maxillary occlusal rim, the occlusal plane is determined, and any correction to the occlusal rims should be done on the mandibular occlusal rim only. Vertical jaw relation. Occlusal and rest vertical dimensions. The distance between 2 points, one at the fixed compartment maxilla and the other at the movable compartment mandible, when the patient at occlusion called occlusal vertical dimension, and the distance when the patient on the rest called rest vertical dimension. The difference between these two dimensions is called the freeway space, and the amount of this space about 2 to 4 millimeters. In our practice, we follow the indirect method for recording vertical relation. In the indirect method, the rest vertical dimension measured at the beginning, then subtract the freeway space from this measuring to obtain the occlusal vertical dimension. After correction of the occlusal rim of the mandible, and get the measured occlusal vertical dimension, to confirm the measurement, closest speaking space used to check the C sound pronunciation, because the person, when want to pronunciate C sound, make a small space between the incisal edge, it's 1 to 2 millimeter, and push the air through it so the C sound will be pronunciate. And we check this by putting the rims in the patient's mouth and ask the patient to pronunciate some words contain C sound, like 66 number. If it is correct, so that means the occlusal vertical dimension, we get it, it's correct. Horizontal jaw relations. Centric and eccentric jaw relations. The recordable relation from horizontal jaw relations is centric relation only, while eccentric relations are any relation of mandible to maxilla rather than centric relation, such as a protruded relation or left or right lateral relations. Centric relation. The most protruded relation of the mandible to the maxilla, when the condyle are in the most posterior unstrained position in the glenoid fossa, from which lateral movement can be made at any given degree of jaw separation. The most retruded is very critical word because the most retruded position clinically, that's mean here and not in unstrained position. And for example, any person can retrude his mandible backward from the centric position to the half to 1 millimeter distance, and this is most retruded, but it is strained. But the centric relation is unstrained position, which is here. So what meaning by the unstrained position? That's the condyle articulate in the most anterior superior position of in the glenoid fossa against the slopes of the articulating eminence. How the patient close in centric position. Instruction for assisting the patient to retrude the mandible while recording centric jaw relation. Some important instructions that guide the patient to close in the centric position. The patient's head is tilted back so that resulting tension of the muscles under the chin makes protrusion more difficult. Instruct the patient by saying, let your jaw relax, pull it back and close slowly and easily on your back teeth. The patient is asked to swallow and close slowly. That depends on the after each swallowing, the patient will close in centric position. In our practice, the tactile method used to record the centric relation. After placing the rim in the patient's mouth, let the patient to close in the centric position and draw 3 vertical reference lines on the wax rim by using the wax knife, one at the midline and the others at the canine eminence. Then ask the patient to open his mouth and numerate the numbers from 1 to 10 and then swallow and close his mouth. Check the reference line. If it is continuous, that confirms the correct centric position, and if it is not continuous, that means it's not correct position, and repeat the procedure from the beginning. After getting the correct centric position, union maxillary and mandibular wax rim by removing 2 mm of the wax from the occlusal surface of the mandibular rim from the premolar area to the end, and V-shaped notches are cutted on the maxillary rim in the premolar and molar area. After that, the occlusal recording material or soft wax is placed on the mandible rim and ask the patient to close in the centric position to the established vertical dimension. Finally, remove both rims together from the patient's mouth and put it on the cast, then mount it in the articulator. Thank you for your watching. I hope it is a helpful video for you.